Yeah, so I'm Dr. Greg Windorf.
This meeting is being recorded.
And I am a gastroenterologist with Gastroenterology Consultants of San Antonio. I'm located here in the Med Center part of our group and have been asked to talk today about gas and bloating, which is everyone's favorite dinner table conversation, I'm sure. But it's a super common complaint. I'd probably say this is something I get asked about more in clinic than just about anything else. I mean, it's pretty ubiquitous. I think everyone deals with it or has dealt with it to some degree at some point. And it's not, sometimes it's obvious, you're feeling bloated or there's certain symptoms, but there's other times that it's not so obvious that maybe symptoms you're having, pain, bowel movement changes, could be um, due to gas and bloating. So um, I will go just a quick overview. So it can, like I mentioned, it can present in different ways. I mean, it could be, obvious excess belching, passing excess gas, flatulence, feeling physically distended or bloated. Sometimes it can be just abdominal discomfort, and that symptom might be a little more difficult to pin down. You eat something and maybe there's some pain afterwards and you think, maybe I got a bug or something, but sometimes it really can just be sensitivity to gas in the gut from maybe something you ate. A couple of quick facts: the average adult produces about 1 to 3 pints of gas each day, normally passed through your bottom about 14, 23 times per day. um, Burping, belching obviously is can be normal, or in or around mealtime, as well. Now, the amount that the amount of gas your body produces is really dependent on a lot of personal factors, diet, and so different parts of different parts of the world with different diets, high or low in fiber, may experience different levels of a normal amount of gas. Interestingly, the most people that complain of symptoms of excess gas actually aren't producing more gas or have more gas in their body. It's really their symptoms are due to a hypersensitivity to the amount of gas in their body. And so that's the most common, although there are certain conditions, certain medical conditions and certain foods that certainly do lead to an excess amount of gas. And we'll talk a little bit about that. So we'll talk about the different sources, where is the gas produced in our body and why. Why are some people more sensitive to that gas, and measures to reduce gas production. So, in terms of sources, where does the gas come from? One obvious one is air swallowing. That's a major source of gas in the upper stomach. This is pretty common during eating, drinking, which is why belching around mealtime, I mean, that's considered pretty normal. Large, but if it's problematic or if it's excessive, that it may be due to maybe eating too fast, gulping down liquids, drinking large amounts of carbonated drinks, and can also be associated with other things like chewing gum, smoking. Uh, this gas is mostly eliminated via belching, and it's usually, the upper part of the stomach stretches, the esophageal junction, uh, esophageal, esophageal gastric junction relaxes, releases the air. And then certain foods are also prone to relaxing that junction between the esophagus and the stomach, so may make heartburn worse, or make belching of normal volume of air more prevalent. And the most common things that can do that are peppermint, chocolate, alcohol, caffeine, foods high in fat. So that's one source, but really the more interesting one, and I think the one that most people are more interested to learn about is I don't think a lot of people realize it's not so much that air is just going into your body. You're producing air, or something's producing air for you inside of you, and a lot of the biggest factor is bacterial production. So a normal part of a healthy GI tract is, I mean, just billions of harmless bacteria live within our bowel, and outside our bowel on the skin. I think I've heard it said that we're more, if in terms of actual numbers of cells, we're more bacteria than we are human. the cells that make up our body are larger, so we see them, but there's actually, if you quantify the number of cells, there's more bacteria on us than there is us. So we need them as part of a normal, healthy digestive tract. But our body isn't able to maybe naturally process certain types of carbohydrates, and so especially carbohydrates, certain types of carbohydrates we ingest, we can't naturally maybe digest them, and so the gut bacteria will digest them and create gas in the product in the process. It'll ferment it into gas. I think a lot of us are obviously familiar with this. With certain types of foods, cabbage, Brussels sprouts, broccoli, or some common ones. They contain a type of carbohydrate called raffinose, which is poorly digested. So those foods are more likely to produce more gas and flatulence. So yeah, the byproducts of these bacteria is odorless gases such as carbon dioxide, hydrogen, and methane. Usually these are odorless gases, although minor components of the gas production can produce that, classic unpleasant odor, trace amounts of sulfur, etc. And then then there are certain types of carbohydrates that maybe only certain people can't digest. The classic example of that is a lactose intolerance. When we're young, we inherently produce lactase. We're able to break down lactose, the carbohydrate found in dairy products. But a more natural state for humans would be to lose that ability. But as we've kind of come to farm animals, drink milk into later ages, a good percent of the population, and this varies on different parts of the world, but a good chunk of the population becomes lactase persistent. So they keep producing that, and they're able to eat dairy. But really, in a way, it's a more natural state to lose that ability. And so in these patients that lose that ability, when they eat dairy, or that's the most common food group, but lactose, essentially, they can get symptoms of bloating, flatulence, diarrhea. There are types of bacteria that can live in the gut, though, lactobacillus, that can help us digest lactose. So there are ways around that in different supplements, but that's a classic example. And then there are other certain medical conditions that can lead to an overgrowth of small bowel bacteria. That's a condition called SIBO, small intestinal bacterial overgrowth. And again, this is an overgrowth. You wouldn't call it an infection, but these are healthy bacteria, but they may overgrow and may be found in excess quantities in the small gut. And so they kind of over digest the carbohydrates and things we eat, and so that can lead to symptoms of gas and bloating. There are this can happen to anybody, but certain conditions are maybe a little more are risk factors for it. People that are on chronic acid suppression medications, diabetics, patients with gastroparesis. But that's something we look for in patients if we can't find an obvious cause for their bloating. Symptoms, I kind of already mentioned this. I mean, it's pretty self-explanatory, but it'll vary for patient to patient and is somewhat dependent on the cause. Some patients might experience excess belching, excess flatulence. Others, I mean, it's the obvious bloating or distension, but sometimes it really can just be a crampy pain, and so and that can be maybe a little harder to tie back to this being a gas issue. And then especially as it goes through the bowel, or like parts of the colon, as it changes angles in the right and left upper parts of our belly, that gas moving through the bowel can be very painful. I mean, I've had patients come in or go to the ER thinking they have appendicitis, diverticulitis, and it ends up being gas pain. So gas pains, you don't want to always just obviously just assume that's what's going on, but the gas pains can be incredibly painful. So like I mentioned earlier, if most patients with these symptoms, it's actually not an excess in gas, it's just a sensitivity to gas. So symptoms and the actual amount of gas in the intestines is not always directly correlated. And this can have a variety of different causes why certain people might be more hypersensitive to it. But this is a big component of a diagnosis or an illness called irritable bowel syndrome, which it's kind of an umbrella term. It covers, a variety of symptoms and causes. So it's a little bit of a grab bag, but at its base, it's the way we diagnose is does a patient have change in their bowel habits, whether that's constipation or diarrhea, and is it associated with some level of pain, either getting worse or better around the time of a bowel movement. And so IBS can, like I said, can have a variety of causes: stress, intolerance to certain carbohydrates, maybe even not true celiac disease, but a gluten intolerance. So it different causes for different people. But one major factor of it is a hypersensitivity to gas. Nerves innervating the gut can be overactive in these patients to the point where just normal stretch of the bowel from what would be considered normal function, normal volume of gas, can lead to intense pain. And this can be those patients that may present thinking that they have a perforation, diverticulitis, appendicitis, gallbladder, and it may just be gas pain. And so one effective strategy for these patients is altering diet away from foods that might be more prone to gas formation. And that's what's called a low FODMAP diet. I use that quite a bit, and I have a couple slides about that here in a little bit. But or giving medications to help relieve gas. There's a lot of over-the-counter formulations, different brands. But if you look at the drugs on the back, the common drug in all of them, most of them will be simethicone, and that's the main drug in Gas-X, for instance. So, that's how we try to alleviate that in those patients. Another illness that is associated with gas sensitivity is functional dyspepsia. So dyspepsia is, it's what we call when patients have some discomfort, pain, bloating in the upper part of their stomach. It's, kind of more commonly what you would hear is indigestion, sour stomach, etc. There's different causes for dyspepsia. That could be ulcers, H. pylori, gastritis, but if those things are negative, it's what we call functional dyspepsia. It's that the foregut, the stomach is very hypersensitive to contents in the stomach, whether that's normal amount of acid in the stomach, normal amounts of gas, food. And so management there is similar to how I mentioned for IBS: dietary adjustments, anti-gas medications, antacids. So those are a couple of the ways that gas hypersensitivity can present. But then, like I mentioned, there are cases where it's actually there is truly an increased amount of gas in the bowel. One would be swallowed air. Like I said, it's normal with eating to swallow some, so belching around the times of meals is normal. You can try to, if you're eating too quickly, and that can be a cause for maybe increased amounts. But in some patients, it's actually more of a subconscious and maybe even psychogenic cause that can be related to anxiety, stress, and subconsciously swallowing excess amounts of air. And so, if this is an issue, mindfulness techniques, reducing anxiety, eating more slowly, avoiding carbonated drinks, chewing gum, smoking, kind of lifestyle modifications to be mindful of that and address it. So, and then foods that may cause increased gas. Mentioned this a little bit earlier. So FODMAPs. So certain foods, which most of them, I'll show you a list here in a little bit. I mean, really, these are healthy foods. They're fruits, veggies, natural foods. We're not really talking about processed kind of junk food, but healthy foods can contain specific carbohydrates that we lump together in this group called FODMAPs, and that's an acronym. The only important part maybe is to remember the F stands for fermentable. So that, these are types of sugars and carbohydrates that get fermented and digested by the gut bacteria and create excess amounts of gas. Not every, again, these are healthy. FODMAPs are healthy. They aren't inherently bad, but in certain patients, they may be more sensitive to this. So, in patients that present with symptoms of, irritable bowel, bloating, pain, this is a good first step to talk to them about, because it's a I won't say it's an easy diet. There are a lot of foods that are common on it, but it's not a diet that has to be followed religiously. So I usually will bring this up on the first meeting and say, hey, take a look at this. Just look over the foods on the no list and see if maybe you're eating a lot of these fruits, veggies that are high in FODMAP. So maybe that's contributing. So and I have a diagram coming up in a little bit, but a low FODMAP diet would be low in wheat, barley, milk, certain fruits and veggies. And I will also see this a lot in patients that are, maybe they didn't have the best diet. They're trying to improve their A1C, their diabetes, and so they start going, or maybe they decided to become vegetarian, and so suddenly they're eating way more fiber, way more veggies, way more fruits than they did before, which you would think is a healthy thing, and it is. But if your gut isn't used to those carbohydrates and that fiber load, it can you may end up feeling worse off initially than you than you started out with. So that's something to keep in mind. And if you're making diet adjustments, healthy diet adjustments, just be aware that it can come with some symptoms while your body adjusts. And then starch and soluble fiber can also cause increased gas production. So that would be in things like potatoes, corn, noodles. There's, in broad terms, two different types of fiber: soluble, insoluble. Soluble is the type that would be absorbed into water. Soluble fiber is found in things like oat bran, peas, legumes, beans, a lot of fruit. It's the type of fiber that congeals in water, and it's helpful for patients with kind of a diarrhea, predominant irritable bowel. It helps give that stool form and bulk, but soluble fiber is poorly digested. And so the common brand that's mostly soluble fiber is Benefiber, and that's why a lot of people, in my experience with that one, especially will experience more bloating with it than others. So just being aware of what type of fiber you're getting also can be important. This is just a quick slide about what the acronym of FODMAP. So fermentable. The O stands for oligosaccharides. These are types of sugar, fructans. Basically different types of carbohydrates, and I'll show the image here in a little bit that's a little more useful. But disaccharides, that would be lactose, so that's in your dairy products. Monosaccharides, that's free fructose in excess of glucose in food. So that's in a lot of fruits, naturally occurring fructose, apples, pears, mangoes, cherries, etc. And then, of course, artificially in processed foods and drinks that are high in high fructose corn syrup. And then polyols, which are sugar alcohols. These are naturally occurring as well: sorbitol, mannitol, xylitol. These occur naturally in foods, apples, pears, different fruits, but they are, because they're lower, I think, in calorie content. They are and lower, I think, glycemic index maybe. So they're often used as artificial sweeteners and kind of sugar-free stuff. So you'll see them in different chewing gum and things. So that's another thing to keep an eye out for when patients are kind of trying to change their diet and get to a healthier diet. They might be eating or drinking certain diet foods, and they might have these sugar alcohols in them, sorbitol, mannitol, etc. And so that can lead to bloating and all of that. This is, you can, if you Google low FODMAP diet, I think this is like one of the first ones that pops up. It's on our website too, but it's I like giving this one because it's a nice kind of diagram, succinct, all fits in one page. So the foods on the left are the fruits and veggies that are and the foods that are high in FODMAPs, and on the right are the ones that are naturally lower. So as you can see, both sides are, healthy. You could eat off the left side of the table there and consider yourself having a healthy diet. But if you happen to be sensitive to these, hypersensitive to gas, you may get symptoms of gas, bloating, discomfort by having a diet high in that. So this one is good because it gives equally healthy food groups to try. It's not just a no list. It's here's options to do in place of. Otherwise, other causes of increased gas production, lactose, I just single out again, just because it's kind of a little bit different process than the FODMAPs. I mean, this is truly, some adults just lose the ability to digest it, and so drinking or eating lactose-containing foods, dairy products will kind of reliably in those patients lead to bloating, flatulence, diarrhea. And so this one's usually pretty easy to tease out. There are tests for it, breath tests, but it's usually, you just say, well, um, hold off on dairy for a week, see how you feel. It's not, in some patients, it's pretty obvious this is what's going on. In others, it's a little more subtle. So, but that's something to keep in mind. It could be a lactose issue. Intolerance to food, sugars, fructose is another common one. And obviously, it's part of that FODMAP description, but also separately, some patients also, for whatever reason, have difficulty processing and digesting fructose. And there's a breath test for this one as well to check for, and this one I'll check more often than the lactose intolerance, just because it's lactose is pretty easy to keep out of your diet for a few days. Fructose is a little more ubiquitous. I mean, it hides in things. So I think checking a breath test for that's reasonable if you're having bloating and we can't really tease out what exactly is causing it. And then, as I mentioned earlier, there's a few other medical conditions: SIBO, which is small bowel bacterial overgrowth; celiac disease; short bowel syndrome; some other rare disorders. So there can be some true causes for excess gas production. So how we diagnose this? I mean, this is a clinical diagnosis for the most part. Often doesn't require any additional testing. Patients come in, say they have symptoms of excess flatulence, bloating, and in the absence of any what we'd call alarm signs, severe diarrhea, weight loss, pain, anemia, blood in the stool, fever, not low appetite, barring things like that, then I'll usually start with just tackling the diet issue, maybe talking about low FODMAPs, giving over-the-counter anti-gas medications, and trying that first. And for a good number of people, that will help. It's it's ingredients can different ingredients can hide in recipes. I mean, we're not always sure all the things we're ingesting, and so when I'll do that, I'll also ask patients to keep a food diary. And I tell people they can do that one of two ways. One would be write down everything you eat, and then write down symptoms, yes or no. A lot of people, I mean, that's my compliance rate with that is pretty poor. I mean, that would be hard to do. So what I suggest, another way to do it is wait until people, I tell them wait until you're having symptoms, and as soon as keep a note app in your phone, a piece of paper. But as soon as you start having any symptoms, real quick, think, what was the last meal I ate? What was the last, what have I eaten in the last few hours, and jot it down. And then maybe over time, as that happens, you can look through and it's not always obvious. There could be just this one ingredient in this one product you're buying that's making you sick each time. I mean, that's even happened to me, and it took a while to tease out. So a food diary can be pretty helpful. But assuming that doesn't do the trick, we can't find something dietary wise, or there's any of those kind of more, those alarm signals I mentioned earlier, then there are some tests we might do in the clinic. Stool tests, making sure there's not excess fat not being digested. That's called steatorrhea. Checking for any infections in the stool. There's the breath tests I mentioned. One for lactose, I rarely order that one. I don't find that as useful. One for fructose, that's a little more useful. And then there's a breath test to check for bacterial overgrowth. And then on that one, so we used to just do one in the office, but recently there is a company that has a product I've started using. It's called, I think, Trio Smart. The patients do it themselves. They mail it in. It's like 9 bags I think the patients have to breathe into. It's a little burdensome, but the data is really neat. It comes there, as I mentioned earlier, there's different types of gas in the bowel: CO2, methane, hydrogen. And what's being shown is that different types of gases might be associated more or less with different symptoms. So this new test, what it did that the old one wouldn't do, can check for specifically methane producing bacteria, which might be more associated, in addition to the bloating and symptoms, also bowel habit changes like constipation. And so we might select slightly different antibiotics with that. So that's just kind of a neat area there's a new tool in. Checking X-rays sometimes can be useful. Sometimes even we'll get CT scans, depending, especially if patients went into the ER, they'll often get a CT scan, and that can sometimes show excess stretch of the bowel, can show excess gas in the intestines. Sometimes we end up having to do an endoscopy, colonoscopy, going in, taking biopsies. Usually in these situations, the results are unless they're like these alarm signs I mentioned earlier. These are tests I don't jump to immediately, because we honestly expect them to be normal. It's a little bit of a rule out test. You're making sure there's nothing else going on. So unless there's really something that makes me think something more sinister is going on, that really wouldn't be my first step, is to go straight to doing a scope. And then doing blood work, checking for celiac disease, other things. So in terms of managing it, a lot of this I've already kind of talked about. Avoid foods that appear to aggravate the symptoms. Be mindful of what you ate before symptoms started, and really being mindful that it literally could be just one ingredient in this one brand of product, and whether it's a certain fiber in there, whether it's a artificial sweetener, so being mindful of what you're ingesting, what you're taking in. Obviously, lactose intolerance, avoiding lactose, or there are digestive aids, Lactaid, that can help you digest that, probiotics and things. If you do follow a lactose-free diet, you might want to consider taking a calcium supplement if you're avoiding dairy products. If you might be fructose intolerant, avoiding foods high in fructose would obviously, and then a trial of a low FODMAP diet. I usually recommend that pretty early on when patients come to me. Then over-the-counter medications, a lot of different choices. Most of them are simethicone containing, Maalox anti-gas, Mylanta, Gas-X, Fazyme. Simethicone breaks up the surface of the gas bubbles, and so that's why it's used. We actually will use this when we're doing endoscopies, because sometimes when we're down there, there's a lot of bubbles and it can make it hard to visualize. So sometimes we'll shoot a little simethicone through the scope and we can see it in real time. The gas, it causes the surface of the bubble to disintegrate. So that's kind of neat, and that's your main ingredient in a lot of these over-the-counter drugs. There are some, I think, over-the-counter products that contain activated charcoal. I haven't personally used or had any patients use those, but those are out there. Beano, that's another common one you'll find in the gas section at the store. It's an over-the-counter preparation, helps you break down certain complex carbs. And it may be effective in reducing gas after eating beans or other veggies that contain raffinose. And then there's, Pepto, can reduce the odor of unpleasant smelling gas. And when I was putting this PowerPoint together, I didn't put it on here, but apparently there's even, if it's not so much the bloating, but if it's the odor for flatulence, there's even some, I've found odor neutralizing undergarments and things. So there are definitely some interesting options out there depending on what your main symptom is. And then, of course, if there really is an underlying cause for the excess gas, like bacterial overgrowth, that's treated with antibiotics. Certain medications you may want to avoid because they can slow down gut motility. So be careful if you're on chronic opioids, calcium blockers, anticholinergic drugs. Other therapies, I think I've talked about most of these, but probiotics is another one. It's still kind of, that's an area of ongoing research. I don't think everyone needs to be on a probiotic by any means, and the data on it's not, it's kind of hit or miss. But if patients come in with symptoms of gas, bloating, and it could be a gut dysbiosis issue, I think probiotics is worth a shot. I've had a lot of patients do better on them, but I've also had a handful of patients saying taking their probiotics was leading to gas and bloating, and they stopped it and they felt better afterwards. So just being aware that sometimes the probiotics may not be helping, they may actually be adding to the problem. So In summary, symptoms of gas and bloating most commonly due to hypersensitivity to gas rather than true gas overproduction, but there are actually some causes of increased gas production. First step on anyone with any of these symptoms, I would say is review your diet, do a food diary, rule out common causes that may have not been just super obvious from the beginning. Make sure it's not a lactose intolerance issue. And in a pinch, just trying the low FODMAP diet. It's low risk, it's cheap. I mean, there's would be no harm in following that diet for a short time and seeing if you get better. And there is some good data, especially with that diet, in irritable bowel syndrome in particular. Don't, you know, I'm also, I guess, surprised the number of patients that come in with they're saying they're always gassy, always bloated. And I ask them, sometimes I forget to ask because I just assume they've done this. But when I ask, well, are you taking any over-the-counter stuff? Are you trying Gas X? And they haven't tried it. So, don't be afraid to try some ethicone, Gas X. You could, they make chewable forms. Those are ones you could keep around. They're safe, benign. And just seeing if those help. But of course, if symptoms persist, if they're bothersome, if there's any of those kind of alarm signs I mentioned, obviously don't be afraid to mention it to your primary doctor, or even just give us a call and we could try to get to the bottom of it. So that is all I have. Thank you guys for listening, and happy to answer any questions if anybody has any.